Is Jim Kuhn. I am a chronic disease patient. I have had multiple rare diseases over the last 10 years that have left me totally disabled. I'd like to talk to you today just briefly about some of the physical and mental impacts that the coronavirus has on us rare disease sufferers. I have two primary rare diseases, Sjogren's syndrome and sarcoidosis. And I also have been taking the hydroxychloroquine drug, Plaquenil, that is in the news so much today. Well, first of all, on the personal aspects or the physical aspects, a lot of chronic illness and rare disease patients have a lot of medical appointments every week and every month. And honestly, this is sometimes the only time that we get out. So now that those appointments have been postponed, except for the most essential and urgent, our treatments have been postponed as well. And we don't get out quite as often. And also, I mentioned Plaquenil, with the government experimenting with Plaquenil. And I just read where they shipped 32 million doses around the US and around the world. That's put a real strain on the supply chain for the drug. And it's very hard for the drug now. I've spoken with some friends who are having a hard time getting the drug, as well as having to jump through some hoops with their pharmacies. On the mental side, this is really where I'm seeing the most impact for myself and for others. Anxiety and depression are common symptoms of chronic illness and chronic pain patients. And this whole crisis is just really triggering anxiety and fear and depressive episodes amongst us rare disease patients. I mentioned a limited socialization that just adds fuel to the fire of making us more depressed. Certainly, we get angry at those non-compliers who are still out there um, trying to live a normal life, even against government directives, and they don't really realize that could be a death sentence for patients such as myself who are immune compromised. So we do get very angry at when we see in the news of people still gathering as normal. Um, One of the other issues is that there's limited mental health therapy available. Some therapists have telehealth abilities while others don't. So, with all these depressive and anxiety and fear episodes being triggered by the virus, oftentimes we're not able to talk to someone. And that really leads me to wrapping up that there are some good ways that we rare disease patients can overcome these issues. The first is simply by joining a virtual support group, such as Inspire groups. I found that being a member here really allows me to have a voice and voice my concerns to a group who understands. And I also get a feeling that I'm not alone and I'm not battling this disease alone. There are other people who know and understand and are going through the same thing. I've also learned that it's good to find a passion. During this crisis, I found some things to do. My wife likes to do painting on her tablet. I like to do a little bit of gardening, so I've started my vegetable garden for the spring. And we also like to take some walks around the neighborhood as I have energy. Otherwise, we try to intentionally socialize. So um, we'll wave at people going by. We'll sit on the porch and talk to people, certainly at a social distance. And once every couple of weeks, we go for a ride. I'm on my fourth week of voluntary isolation. So there are impacts caused by the coronavirus, and there are opportunities. The biggest is I advise people to help others. The best way to help yourself through a crisis is by helping others. So pick up a phone and say hi and check on your friends and your neighbors and your family. And I guarantee it will it will make you feel better. So thanks for listening to my story. I appreciate it. You guys have a great day.